Baptist Health is proud to now be home to Ion, a robotic bronchoscopy that's proving to be a game changer when it comes to patients with lung cancer.
The advantage of having the Ion here is speed to diagnosis. I mean, it's well described that the quicker you diagnose and get somebody treated with cancer, the better they do in the long run. You know, lung cancer is responsible for the most cancer deaths of any cancer. There's about a 5% chance of people getting it in the United States. 1 in 5 people are non-smokers who get lung cancer. So it's important to find and treat early if you can. There's a way to biopsy these with a bronchoscope. A bronchoscope is the scope that goes down your windpipe. And traditional bronchoscopes were pretty big and they couldn't get that far out in the lungs. And there is a new one that is small and really flexible, and they made a needle that can get through that, that's still stiff enough to do biopsies. And so you can get a lot farther out in the lungs, and it'll stay still to biopsy a lot smaller lesions that we used to just follow and have to wait until they got bigger before they were biopsyable. Lung screening tests, in addition to almost any screening test for cancer, are important. You know, they're all very regulated because it's looking for a disease that isn't there yet. But anytime a doctor recommends any screening test for cancer, it's important to think about, because any cancer, the earlier you get it, the better chance you have. Having the Ion here, the thoracic is part of the cardiac is the chest part, that's our lung part. And, you know, it's near and dear to my heart. I mean, I like fixing hearts and getting rid of cancer. That's the perfect days, you know, one of each. But screening tests are important for everybody, so always listen to your doctor if they tell you to get a screening test for any cancer.
Thank you, Dr. Cook. To learn more, visit baptistfirst.org.